prostate cancer awareness? We observe it usually once a year, but what can men know about what do you want men to know about prostate cancer year round?
So I think one of the biggest things, and this is in general for men's health, is that we know that guys don't want to talk about their problems. Oftentimes face their problems, you know, they like to try and fix them on their own. And, you know, that's just guys being guys, right? You know, we see a problem in our house. We see a problem, you know, with our job. We see a problem, you know, that someone else is going through. We're going to try and fix it for them or with them. And that's what we like to do. But, you know, for whatever reason, when it comes to our health, guys go silent. They kind of don't want to talk about the problems that they have. And I think that a lot of that is because, you know, there's this huge stigma of admitting that you have a problem is maybe a sign of weakness or, you know, seeming less masculine. Now, I think the important thing here to understand is that, you know, when it comes to your prostate health or prostate cancer risk, we're no longer talking about some invasive procedure. We're not talking about getting a rectal exam. Our guidelines just changed this year for the digital rectal exam. And there's a lot of data suggesting that a lot of guys don't want to come talk to a doctor because they're scared of getting a finger in the butt. Now, we don't have to do that anymore. And you know, a simple blood test which is a PSA, prostate specific antigen, is really all you need to do. And, you know, even if your primary care doctor can do it, a urologist can do it. It's a very simple test that is non-invasive other than a blood test. But, you know, a lot of guys who would otherwise be concerned about talking about any of their other problems or getting that exam that they're worried about, you know, they don't have to worry about it anymore. And I also, just going back to that male stigma, I think the manliest thing you can do is identify a problem or identify a concern and fix it, right? And that's what we're talking about. But when we're talking about things like cancer and men's health, if you don't talk to anyone, you can't fix the problem. And if we're all about fixing problems, you know, being vocal and at least to your private practitioner, you know, in the privacy of the office or via telemedicine is the best way to start going about that, because you can't be the man of your household. You can't be, you know, the person that, you know, people look up to, if you're not leading by example. And if you want people to take care of themselves, you got to lead the way as well.